I'm Mandy Cohen. I'm the director of the Centers for Disease Control and Prevention. It's great to be here in Alameda County and the Bay Area to talk about the importance of vaccinations. I got my updated COVID vaccine yesterday in LA, and I'm happy to be here and making sure that we are protecting our seniors. It's great to be here at a senior living center where we are getting folks vaccinated for COVID, for flu, and for RSV. We're making history this season. We have vaccines for all three of these illnesses, and I'm grateful to be joined here by Dr. Aragon, who's the head of public health for all of the state of California, and of course, Mayor, thank you so much for being here as well. As we know, protecting the public and making sure we're all healthy is a team sport, so it's great to be here with folks from the state, folks from the county, and of course, the doctors, nurses, and the incredible staff here who are taking care of residents every day. So we want to make sure folks are getting their vaccinations and protecting themselves, and I'm happy to take your questions.
Do you worry at this point about fatigue when it comes to these?
So I know we wish we could all be done with COVID and leave it in the rearview mirror, but two things, right? So I know folks are saying, I've had COVID before, I've been vaccinated, but no, this virus has changed. And second, your protection is decreasing. So it's really important that you get this updated COVID vaccine to have the most protection you can. And look, I'm not just the CDC director, I'm a mom, I'm a wife, I'm a daughter. My kids who are 9 and 11 are getting vaccinated. I got vaccinated yesterday. My parents who are over 65 getting vaccinated. I wouldn't recommend something for the American people I wouldn't recommend for my own family. So I know we wish we could be done with this, but getting vaccinated is the best way to make sure you're going to have a great Thanksgiving, a great Christmas, and make sure no one is sick and in the hospital during those times. So remember, these vaccines protect against the worst of what viruses could bring. We want to make sure you're getting protected.
You say updated COVID vaccine, but not booster? Are we not using the term booster anymore?
Semantics doesn't matter. If you want to call it a booster or an updated vaccine, just get yourself protected. We say updated vaccine so folks know that it is new and tailored to the changes in the virus. But whatever you do to get yourself protected, the updated vaccine is available for you, and we encourage you to get it in the month of October so you can be protected this whole winter.
There's been some confusion with insurance coverage for the vaccine. What are y'all doing to relieve that confusion?
Yeah, so it's a new process this season. So previous folks know that the federal government purchased and distributed all the vaccine. This time we are using the private sector to make sure that vaccines get to everyone. That means for the first time we are using folks' insurance coverage to cover the cost, or there is a free program. So there is a free vaccine, a COVID vaccine out there for you, either through your insurance or through a CDC program called the Bridge program. However, look, anything new has a few bumps along the way. We think we've worked out all those kinks. You should not be paying out of pocket for these vaccines. Make sure you can get a free vaccine, and make sure if you're having any issues that you're calling and resolving those, and we'd be happy at the CDC to make sure we're troubleshooting any issues.
Do you think the federal government should have done a better job with the rollout?
Well, we have to rely on our teammates in the private sector. So while the federal government did have the reins the last couple of years, unfortunately, now that is not the case. And so we are partnering with the private sector to do that, and we're working through as they make their improvements. But as I said, now we're really seeing vaccine everywhere, and want folks to call ahead, make your appointment, CVS, Walgreens, Rite Aid, pharmacy, your doctor's office, lots of places where you can go and get an appointment to get your vaccine.
Could you talk about the vulnerability of this older demographic and what that means for the rest of us who are out and about when we go visit our older relatives and that kind of thing?
So we're here at a senior living center, particularly to remind folks who are over the age of 65 to get vaccinated. The folks who are over 65 are still seeing the worst of what COVID could bring, meaning those are the folks who are likely to be in the hospital and sadly still dying from COVID. And so we really want to make sure we're protecting our seniors. I don't know, Dr. Aragon, you want to mention anything specifically about California and our seniors?
Well, what we want to remind people is in California, you can always go to myturn.ca.gov and get connected. And of course, wherever you live, you could always reach out to your local health department to get connected if you're having trouble finding the vaccine. But again, myturn.ca.gov is what we've been using for all these years now for COVID, so it's still there for you.
Good. And what's incredible about what's happening here in Alameda County is the partnership, working with community organizations like La Familia to make sure we're building trust with communities and that we are bringing vaccine to folks. I'm really proud of the collaborative work here where folks are not only partnering with schools and senior centers and others to make sure that folks can get vaccines and protect themselves.
Do you expect winter to see a spike in COVID cases? Do you expect like winter's coming, you know?
So we know every winter that we're going to see more viruses circulate, whether that's flu or COVID or RSV. But the power's in our hands right now to protect ourselves. That's why October is a really great time for you to get vaccinated. That means as we get into that later fall and into the deep winter, that you're going to be as best protected as you can. Again, vaccines will prevent you from the worst of what viruses can bring, which means going to the hospital or potentially even dying from these viruses. So protect yourself, protect your family. You can get your COVID and flu shot on the same day, one appointment, get them both done, and then you're protected for the winter.
I think we have time for one more question.
Can you talk about how both the feds and state public health authorities, how the data collection has changed if, God forbid, there were an outbreak in a facility like this one of COVID, though it could easily be flu as well. How would it change? How is it different now than in previous winters?
So we are outside of the COVID emergency. So things are a bit different now in terms of our ability to see and to respond. But what I want to assure folks is that we still do a lot of data collection. We are still sequencing tons of virus to make sure we're understanding how it changes. And then we partner very closely with the state of California, with the county here, who is still tracking and making sure that we're staying on top of these viruses. Maybe I'll turn over to Dr. Aragon for California.
Yeah, that's a really great question. And you know, because of a lot of home testing, we have less visibility. One of the things that we continue to do in California that is not done in other states is that we continue to get every official test that's recorded. So if you go to a health system and they do those PCR tests, we actually get whether it was negative or positive. So we continue to report what's called test positivity. So when you go to our website, it gives you an idea of those people coming in and what proportion of them are testing positive. So it's one of the indicators. And of course, hospitalizations are really right now our most reliable indicator of how it's going. And we do expect for all of this to increase this winter. That's why everything that we're talking about is really important.
Is there data at this point on how many Californians have been vaccinated with this new shot?
So with the new shot right now, well, it's just been a few weeks. So the numbers are going up as the vaccines get out there into the community. We continue to see a disparity between the lower income areas and the higher income areas. The higher income areas are doing a better job of accessing those resources. So we really have to reach out to our diverse communities and really make them aware of how important this vaccine is.
Mayor, is there anything you want to say?
Well, and maybe I could just jump in and say what we know nationally is 7 million Americans have already rolled their sleeves and got the updated COVID vaccine. And we think that's the lower estimate. Again, so at least 7 million Americans have already gotten the COVID vaccine since the new one has been out. Join those 7 million and protect yourself today. But let me turn it over to the mayor. And as I do that, I want to present the mayor. Thank you for being here today with a coin. These coins represent that you're part of team protecting health across the country. So mayor, thank you for being here. And Dr. Aragon, also one for you. And I want to recognize also the supervisor of Alameda County. Thank you, Supervisor Tam, for being here as well. So mayor, anything?
So my quick thoughts are simple. It's important to be part of this team. I've received my updated COVID vaccine on this side, the most recent flu vaccine on this side. Let's go out and also let people know. When you get vaccinated, let others know that you're participating, because that's what's going to make the difference in keeping us all safe.